So we've been funded for the next 7 years for the MWCCS, which is the MaxWise Combined Cohort Study. We are unique because we are the lengthiest longitudinal study of people living with or at risk for HIV infection in the United States and probably the world. We've been following the women in this cohort for 25 years and the men for over 30 years. And right now in 2019, we combine these two cohorts to continue to follow them up over time and explore sex differences in aging with HIV infection. So anti-retroviral therapies have made a big difference in the lives of people with HIV infection, obviously. People are living, and they're living longer, they're surviving. We don't see the same types of AIDS-related outcomes as we saw early on in the epidemic. We don't see Kaposi sarcomas, for example, and wasting and things like that. So people are aging now with a chronic infectious disease due to the success of anti-retroviral therapies, but now we don't know how they're going to age. Are they going to age successfully? Are they going to have more morbidity? We already know that people who age with HIV infection do enter aging with more morbidity. So part of this is as a result of the infection. Part of this is from some of the socio-demographic characteristics of the individuals who have HIV infection or who are at risk. And some of it has to do with the effects of the anti-retroviral therapies. Some of the therapies do increase cardiovascular risk and increase obesity. So while they are very beneficial for controlling the infection, we're unsure about the long-term effects in relationship to other outcomes that are traditionally associated with aging, such as cardiovascular disease, lung function, for example, also cognition, cognitive impairment, and late life dementias like Alzheimer's disease. So the MWCCS traditionally and historically, for as long as 25 to 30 years, has been an intent to treat cohort, which means that we've been evaluating these participants every 6 months over time. So this is very much a clinically followed cohort of individuals. Viral loads are checked every time. CD4 count is checked every 6 months that they come in. And so as a result of that, over the longitudinal history of the cohort, there's been very much a bench-to-bedside approach in relationship to monitoring the natural history of the HIV infection. How are the treatments influencing viral load? Do we need to change the treatments? We track that. We can feed back to the participant, to their care provider. And so it's always been a very dynamic type of a cohort in terms of the feedback and then therefore increasing quality of life and care for the participants. The combined cohort study is going to tell us a lot about usual aging and not just HIV-associated aging, because we have measures not only of infectious disease, but of cardiovascular disease, cerebrovascular disease, which is brain health. We have studies of lung function. We actively measure lung function. And we're also looking at a variety of other issues that pertain to women and men specifically. So for example, the women all along have gotten pap smears. And so that we have a lot of different types of measures that are being done, have been done, that can tell us more about usual aging in addition to aging with HIV infection.